On this episode of Insight, more young people are questioning their gender. Have we got the balance right? Sandy, you're here with your son, Cairo. What was going through your head when Cairo started to question his gender when he was in his teens?
I was unsure about what was happening. He was in a peer group at school. There was questions around, not feeling right in himself, not happy with people looking at him as a female. The questions he was asking was around those sort of things, not feeling right, and I could relate being a tomboy and stuff in my younger days as well. So I sort of thought, well, maybe this is a phase, and then slowly just not really feeling happy about what she was wearing anymore, just feeling uncomfortable, not wanting people to look at her. I wasn't sure what was going on, really. Yeah.
I noticed you use female pronouns for Cairo. What have been some of the things you've had to adapt to?
Well, I'm still saying she a lot, and I know I've got to change that. And I did encourage Cairo to put the name on the driver's licence that you just went for, and said I'll try and make an effort to say him, but it's still really weird for me to say him when it should be her to me in my mind. It takes a bit of time, is all I can say, to adjust and get your brain right with things.
Cairo, how did it feel talking to your mum about your gender?
It was scary. It was very scary at the start of just feeling everything and feeling how you feel. So when you're going to a parent to discuss how you feel and bringing it up to them and essentially being told that they don't believe you, kind of, it was really hard because I'm more close to my mum than my other family members. So it was very hard having that one person who I thought was the closest to me tell me how I felt wasn't really real. But I did have a good friend group, so I still had people to talk to it about, but it sucks when that's your favourite person who you want to really connect with the most and they don't see it the same way you do. But we're way closer, and she says my name here and there, says my pronouns here and there. She helped me legally change my name and helped me do the forms and everything. It's just still more of an adjustment, and she's helping me with a future surgery that I'm getting. So there's still parts where it's very supportive. It's not that full connect yet.
When did you first raise the prospect of being prescribed hormones to look more masculine?
I was aware that once you're 16, your parents can give consent to give you hormones, essentially. So I was aware of that. So I think I bring it up to my mum around 15, 16, and it was kind of just well, you should wait, you should really figure out how you feel.
Internally, did you absolutely feel male?
I feel like I am not the stereotypical man. I have always been quite feminine, and I'm gay. I like other men, mostly. But yeah, it's just the idea of being perceived as a woman. It just felt wrong. It felt so much disconnect from who I thought I was. There was just an imbalance with how people see me and how I saw myself internally, I guess.
Sandy, why did you want Cairo to reach adulthood before starting hormones?
Because I was hoping maybe it was just a phase. It was just going to settle down. Because I've heard that the brain is not really mature until 20, 25. So I just thought a bit more time, just to let her really understand her body, understand people around. I mentioned relationships and things like that. You won't really know what you're really into until you've had really good relationships, I've felt anyway, myself.
Cairo, how did it feel to be told you couldn't take testosterone until you were 18?
It was just that constant feeling of, well, no one's taking me seriously. I feel stupid. I don't feel comfortable even going outside and talking because my voice was so womanly that I just felt so uncomfortable. I didn't want to talk, so I didn't really talk. Yeah, I felt constantly in a limbo state of waiting and just uncomfortable constantly.
And as soon as you turned 18?
I ran to the GP. Yeah.
You're there on the day?
Probably a month after, probably.
Grace, you've identified as female from a very young age. What was your childhood like?
My childhood was very tormented for many different reasons, and I feel in regards to my gender, it was something that did take me some time to figure out. I was 12 years old when I came to the realization that I did want to become a girl and live my life as a girl for the rest of my life. And I was allowed to express my femininity, but I was also encouraged to explore with more masculine toys and dress-ups too. I really had an open upbringing where I was allowed to express myself.
You saw a documentary when you were 12. What was that?
So this was a documentary about a girl of similar to my age at the time who was going through puberty blockers, and it was explaining how puberty blockers are buying you time to prevent the permanent effects of the puberty that your body biologically wants to give you. And to me, I was just opened up to this whole new opportunity that I could really actually live as who I always felt I was.
You were on puberty blockers for around 2 years before starting hormone therapy. What did transitioning young mean to you?
Transitioning young gave me the autonomy as a woman to decide how I present to the world. By pausing my body's natural process of going through male puberty, it allowed me to really pause and seek the help that I needed to really divulge what was going on in my head. And I now have the privilege of being able to walk through my life and not having people just know that I'm trans by looking at me. I also didn't have to watch my body morph into a man during my adolescence. And I knew that I was going to transition. I knew it in my soul. And so I was able to save myself a world of further trauma.
Let's see what medical treatment available to transgender people under 18 looks like.
Until puberty, male and female bodies are physically similar. As a child approaches puberty, the body releases hormones which stimulate physical changes. In males, testosterone production increases, and females will see higher levels of estrogen and progesterone. Males will experience changes like facial hair growth and voice deepening. For females, puberty triggers changes including breast development, widening of the hips, and menstruation. Medications, commonly known as puberty blockers, can be given to children with a diagnosis of gender dysphoria in the early stages of puberty. These temporarily stop the body from making sex hormones, preventing physical changes. Older teens and adults may be prescribed gender-affirming hormones, whether or not they've received puberty blockers. This means those assigned female at birth are prescribed testosterone, and people assigned male at birth receive estrogen. This initiates the physical changes of puberty that align with the individual's gender identity.
Olivia, you're a psychologist who works closely with minors questioning their gender. How common is it for young Australians to identify as trans?
It's a difficult question because we don't at this stage capture population level data in the census, for example, around trans identity. But there has been some really great research in Australia on this. So most of that research is pointing towards a figure of around 2 to 3% during sort of the adolescence, or sort of up to age 25. And for adults over 25, they're looking at perhaps about 1%.
There's been controversy around puberty blockers. Why are those drugs important to your patients?
I love my job, and I see families like some of the people that are in this room, and I see a lot of tears. But for me, a lot of the tears are from enormous relief. That when they get access to that pause button, as Grace was describing, they just shed tears of relief that they don't have to undergo their body changing into something that is not who they truly feel themselves to be. So it can be significantly life-changing in the moment. So, yeah, puberty blockers matter.
Elliot, you began to medically transition when you were around 17. After you'd gone through puberty, what were your early teens like?
Under the age of 12, I didn't really care much for gender. I didn't really think about it. And so being younger, it was more okay for me to do more things alongside my brothers or do more masculine things or just androgynous things in general without being ridiculed or criticised. And then when it came to 13 years and older and puberty started to kick in, I was a little bit of a late bloomer, but when that started to happen, my friendships changed, my relationships changed, my mental health started to decline. I really started to feel confused and distressed. And because there was not much of a conversation regarding trans adolescent healthcare, it was kind of something that you felt ashamed for feeling. So you had to keep it to yourself. And so you have this cycle of ruminating on what gender is inside your mind, and then also being afraid to say anything regardless of your situation because of what I had heard from society in general and what I had heard from my school community that made you think twice before being open and honest about expressing yourself that way.
And because you began to medically transition when you were 17, it was too late for blockers for you, so you went straight onto testosterone?
Yes, that's right.
Olivia, many clinicians, including yourself, take a gender-affirming approach to medical care. What does that mean?
Gender-affirming care, to me, has two fundamental principles. So the first is trans people are real. They exist. People whose gender and sex are incongruent. The second principle is that you don't pathologise gender. There's nothing wrong with anybody who is trans. And if you've got those two principles clear in your head as a health practitioner providing healthcare, you then move on to what is a very classic approach to healthcare called evidence-based medicine. You take the research, the literature, the knowledge base from all of the incredible people who do these studies all the time. You take your own qualifications and clinical expertise. And most importantly, you listen to the person who's in front of you. And together we come up with a plan that can help them make changes in their life that they want to see for themselves to improve the quality of their life or to head in a different direction, whatever the case may be.
Can you explain the affirming part of that model?
Affirming just means I'm listening to you and I believe you and I'm here to work with you and find a way forward, but I'm still going to be using all of my normal assessment skills. I'm still going to be talking about research and risk and side effects and what's in the best interest, etc.
Vanessa, you're a psychologist in private practice. Your industry body recommends a gender-affirming approach. How do you feel about that?
I see the gender-affirming approach as it's put forth by the Australian Psychological Society as very problematic. As a body for psychologists, we're described as being evidence-based. And so the guidelines around gender care for young people don't fit that evidence base. When we're looking for working with people in any area, we really want to look at what is the highest level of evidence that's available. And so we now have systematic reviews that have been conducted around the world by independent countries and organisations that have really found that there isn't a good evidence base for gender-affirming care. And in particular, the medicalised aspects of this for children in particular. So the APS doesn't, at the current position statement, excludes all of those things.
When you work with patients, do you have one model of care that you generally work with?
No. Typically, as a psychologist, I'm what we call a feedback-informed therapist. So that means that people come in to me, I use my usual psychological skills to say what's going on, what's bringing you in. I don't have a model in my head. I have a range of models to pick from. And once I've got to know the person, once I've done that exploratory aspect, that finding out what's going on for the person, why they're coming in, what's the context of their life, I then pick the model that's going to work best for that individual. And this is quite different with the directions from the APS. They say you must use a gender-affirming model.
You've been seeing gay, lesbian and trans patients for nearly 30 years. What have you observed that shaped your perspective on this? So
probably the first 20 years, I just definitely went into working with gay, lesbian, bisexual people and just that queer community in those early days. As a lesbian, as a gender non-conforming person. It's really important to have representation, I think, in those professions. Then about 10 years ago, I started to see a number of transgender individuals come in, and they came in and said, I'm identifying as transgender, this is the issue that is going on for me. And at first it was a trickle, and then in the last 5 years, the numbers have just grown exponentially. And the other thing I noticed was that the vast majority of them were neurodivergent in some way. So these were young people that were coming in, or are coming in, with a lot more complexity and with a whole range of backstories that were quite different from, I guess, the earlier cohorts that I was seeing.
Olivia, do we know what proportion of minors who attended gender service receive blockers or hormones?
The folks at the Royal Children's Hospital in Melbourne did an audit of 10 years of patients that they saw, and I think the figure was around a third accessed medical treatments. In 24 in Queensland, there was an independent evaluation and review of the gender service at the Children's Hospital, and they also found that it was around about a third had accessed either puberty blockers and or hormones.
Recently, Queensland and the Northern Territory banned medical treatment for transgender minors. We spoke with a mother and her 14-year-old daughter about what the changes in Queensland mean for them.
We're not out in our community. No one where we live knows.
In 600 metres at the roundabout,
My daughter socially transitioned. She was the first kid at her school who ever transitioned. The school was really supportive, but she was bullied in the playground by a group of boys. We're still paying the price in terms of the anxiety. That's never fully gone away, and she got behind in her schooling because I was dealing with school refusal. I couldn't allow her to continue at that school, so we moved to a completely different area where we knew no one. And she passes. She looks like a girl. And so puberty blockers are enormously important for my daughter's emotional well-being, and I think for her physical safety.
Can I have this?
Oh, I guess so. She was just horrified at the prospect that she might have to go through male puberty.
A deep voice, face her. It felt like I was going to turn into somebody else I didn't want to be. It feels like I am living as a girl, instead of being trapped in a body that I didn't want to be in.
When we found out about the Queensland Government ban on gender-affirming care, I was just furious because we were so close to getting her treatment, but I assured her that we would get treatment in the private sector. It's horrifyingly expensive. The first 2 times that she received the puberty blockers, it cost $739 each time, and they only lasted for 3 months. My mother had to pay for them, and I've had to pay her back. I've actually taken action against the Queensland Government. They didn't consult a single person who had any expertise with treating trans kids.
There you go, babe. Thanks.
And that, to me, is proof that the decision was not about the medical safety of my child. That was a decision that was based on ideology. Politicians should not be making decisions about kids' medical care.
Olivia, you're a founding clinician at Queensland's only public gender service. What do these changes mean for transgender kids?
I don't know that I can add more than what that mum has shared there, which is that if you don't have enough money to go to private care, you don't have care in Queensland anymore. And so it's created this real inequity.
Vanessa, you also practice in Queensland. Yes. How do you view the changes there and in the Northern Territory?
When we look at the bigger picture, this actually falls very neatly in line with countries around the world. So countries that we would call very progressive and that we would consider not at all outrageous. Countries like Sweden, Finland, Norway, the United Kingdom, and they're all following the same evidence. These high quality systematic reviews and meta-analysis that are being done around the world. And that's been the conclusion that they've come to when they really look at all the evidence and they move away from consensus-based guidelines. You know, the Queensland changes have actually fallen in line not only with guidelines from around the world, but also the highest quality of evidence we currently have on this.
Hugo, you began transitioning at 16. How do you feel about the debate surrounding young trans people and medical treatment?
I think it's really complicated because it's not something that's black and white at all. I have a lot of empathy for young people who are seeking puberty blockers that have questions about their gender. I have a lot of empathy for the parents that are supporting them and feel powerless to do so. But at the same time, what I see as trans representation, a lot of the time I can't relate to.
In what way?
I see gender dysphoria as a disorder because it's something that causes a lot of distress. When something is impacting you to the point that your cognition is impacted, your mental health is impacted, your relationships and your ability to function in the world, that by definition is a disorder. And I can't sit here and say that I need medical treatment and also say that I don't have a medical condition.
You had top surgery, a double mastectomy to remove your breasts at 17. Was that an easy decision to make at that age?
No, it wasn't. And I don't think it should be an easy decision for anybody at any age at all. The ideal situation is if there was a magic pill that would have made me happy to be a woman, I would have taken that in an instant because that would have been the easiest, fastest, cheapest option. But that doesn't exist. And there is so much consideration that goes into deciding to get a double mastectomy. I thought about my entire life. How will I feel about it in 5 years, 10 years, and 50 years? It was a decision that was based on how much the gender dysphoria was distressing. That was the source of my pain. And it wasn't something to take lightly. It's not, to me, that's the last resort.
It is rare for people under 18 to have gender-affirming surgery. Was it fair to let you make that decision?
I had a team of people that were there to support me and to make sure that it was fair for me to make that decision, that I was mature enough, that I was aware of the consequences, of the risks, because everything has a side effect. It's not just the magic solution. There are things you do have to sacrifice. And it's really important to accept that. And I think if you go into it thinking as this is something that's going to fix my life and everything is going to be okay, that's a really dangerous mindset to make that decision in.
Do you feel like it is the right decision for every young person?
It would be very irresponsible for me to say that it's the right thing for everybody and that if you do it, you're going to be happy, because it's such a complex and nuanced situation. It needs to be approached from a really individual perspective. So I can say, yes, it worked for me, but I wouldn't go around and say that it's going to be okay for somebody else to make the same decision.
Michelle, you're the parent of a teenager who identifies as trans. What was your child like when they were little?
She was like just this burst of energy, confident, strong-willed. But in year 6, her mental health declined quite rapidly, with her having a psychotic episode where she dissociated and harmed herself. And following the ER visit, we realised that we needed some professional help.
You took your child to a public mental health centre. Your child then gave you a letter explaining that they're transgender. What did that letter say?
It was a short letter saying that my daughter identifies as male. My daughter being 12, 13. My husband and I were both shocked, but we told her we loved her and we supported her, but we didn't understand. When she's stereotypically always been a girl and never experienced distress around her gender.
And the mental health professionals your child had been seeing, what did you think about their response?
disrespectful. They immediately affirmed the transgender identity. They would not enter a conversation about it with me, other than to tell me that I needed to educate myself, and they wouldn't have a philosophical discussion. My daughter will always be my daughter. If she wants to cut her hair short, if she wants to wear boys' clothes, that's fine. But for her to think that that means that there's something wrong with her that needs fixing is, I personally feel, damaging to her mental health, especially considering she's experienced psychosis, hallucinations, anorexia, all things that are distorted beliefs.
How did that anorexia diagnosis come about?
Unfortunately, her GP, the psychiatrist and the clinic all missed it. I don't know if they even ever asked my daughter about her eating habits. As soon as gender was mentioned, it's just like, well, that must be the problem.
Olivia, you're employed at a public gender service. How common are complex medical histories among the people that you see?
I would say uncommon in the sense of what that mother was describing there. Across my career, which is both private and public, I would estimate I've probably seen around 500 trans and gender diverse and gender questioning young people and adults. The number that I've seen who also had a psychotic illness I could count on one hand. So that is quite rare. Disordered eating, though, is more common.
Do you see any cases of autism and ADHD?
The research is very clear that there is a large co-occurrence of autism and gender dysphoria, or gender incongruence rather. We don't know what causes autism, and we don't know what causes some people's gender to be different to their sex assigned at birth. However, research is indicating strong genetic influences in both of those presentations. So perhaps in the future, as research continues, we may have some answers around why there is that co-occurrence.
Grace, your transition at 13 was managed at a gender service at a large public hospital. How would you describe your assessment and care?
I would describe it as extremely thorough and very carefully done. I had to have many sessions across months before even the possibility of puberty blockers even came about. And while that was what I was seeking since the beginning, it really was quite a process. That included a bone density scan to make sure that my body was able to go through this hormonal change, and then also multiple psychiatric evaluations from psychologists, and as well as just the once-over of physical health as well.
Was anything missed during those consultations?
So I was recently diagnosed with ADHD, and this is something that has impacted my life in so many ways. I have had treatment for this for just a few months, and my life has already completely transformed in ways that I could never have even imagined.
Elliot, what was your experience at the gender service you attended when you were 15?
The first thing that comes to mind is open and understanding, but also incredibly thorough. In my situation, there was over 1.5 years of psychological assessments and doctor's appointments, information sessions where I'd go through the pros and the cons, the risks, and also if there was things, side effects that were permanent that I would look forward to, like a deeper voice or facial hair, most of those things that you discuss and you find out as you go through those sessions. I didn't feel like there was any stone left unturned in that situation.
Do you feel like you were able to make an informed decision about the consequences of your treatment?
Absolutely. So I elected not to get a bilateral mastectomy, which is top surgery. And in order to do that, but also still present as male in most cases, I still wear a binder. And so that is in itself restricting, but it is a choice that I've decided to make. And there are lots of trans people who have unique experiences, but there are still enough common experiences that we kind of all understand, like public bathroom usage and being misgendered and how to deal with that. And also always feeling like you need to prove yourself to other people.
Kev, you transitioned in your mid-20s. What was that like for you physically?
shocking at first. I knew that I would have emotional changes. I knew that basically that your hormones regulate or influence your emotions in a major way. I had anger issues at the beginning, which were kind of shocking because before I started testosterone, I was 26 when I started, so I was pretty settled into early adulthood and knew myself pretty well. So if I was angry before that, it was kind of more an intellectual exercise. Oh, that's really annoying, and they should know better, and actually that's really rude. And you kind of work yourself into it more and more as you go along. It's not actually a physical experience. When I started taking testosterone, that changed pretty much straight away, and it would be a case of, you know, like my head would start getting super hot, my ears would be burning, and I would get kind of just reactively angry while not really understanding why I was angry. It would just hit you out of the blue.
Given your experience, do you think people under 18 should be allowed to medically transition?
No. No, I don't think so, which is kind of sucky. I appreciate that. But for all the best reasons in the world, you have adults in positions of authority over kids telling them that they can actually change sex, which they can't. Like, you can alter your physical experience, you can present as the opposite sex, but you can't actually become the opposite sex. And because we live in our bodies, the kids at some stage are going to figure that out. And like, that would have to cause some pretty serious trust issues as time goes on. Like, I was 26 when I transitioned, and I thought, I don't know everything about this, but I kind of trusted in my own ability to take responsibility for my own actions. And I kind of, you think in your youth, in your early 20s, even in your early 30s, you kind of have this sense that the you that is you will be the same, you know, projected throughout your life. And I'm 50 now, I'm halfway through my life, or more than halfway through my life. And almost half of my life has been spent transitioned. And the way I feel about it now is quite different than what I did before. Like, you know, your life never ends up going the way that you think it will be, and you don't end up become the person that you think you will when you're 20 years old or 25 years old. You turn into someone completely different.
Vanessa, why does starting medical treatment during adolescence concern you as a psychologist?
There's a couple of things that really come to mind when I think about this. And the first is our bodies are really complex ecosystems, and natal sex hormones are a part of that. And so when we start to interfere with that process, when we stop a natal puberty, it has a flow-on effects to the other parts of the system. So I often give the analogy of, you know, freshwater systems and saltwater systems. And so, you know, we are born with an innate system that is one of those systems, except with some very rare exceptions. And if we were to look at nature's systems and go, okay, we're going to turn this freshwater system into a saltwater system, we would go, oh, that's going to have some really big flow-on effects. It's going to have some intended effects, like puberty blockers are going to have stopped those secondary sexual characteristics of puberty, but they're also going to have flow-on effects to a whole range of other things that we don't intend. And there are certain identities that develop across our lifespan that occur in a developmental sequence. And so sexuality is one of those. So gender identity can occur at different points in our life, but sexuality occurs after we reach sexual maturity. So there's a real problem that if we don't reach sexual maturity, if we don't go through puberty, we can't actually know what our sexuality is. And so that, again, becomes very problematic. Should we give something up that we haven't experienced? Should we stop something that we haven't had an opportunity to explore?
Hugo, we've been talking about medicine and science, but is it also about identity?
I always struggle with that one because I don't really understand when people say, oh, so you identify as a man. I don't see it that way. I don't identify as anything. I know I'm not a man, but the only way for me to go about living my life as myself was to transition and to live as a man. At the same time, it is a part of my identity in the sense that it's my experience, and all my experiences in life have made me who I am today, and they affect the way I see the world and the way I interact in the world. And I was once really ashamed of it. I've since learned to see the value in that.
Have you noticed a shift in how many people seem to identify as trans?
Yeah, that's something that I see a lot, and it does concern me because and this is first-hand experience of people going up to me and telling me things, that it seems like some people have a very light-hearted approach to it, thinking transition is something that you can just dip your feet into and see if you like it, and pick and choose what effects you're going to get from the hormones, and then it's all going to be magically fixed and there's no consequences. But in reality, I don't know what the hormones are going to do to my body in the long term, and that's something that you need to accept.
You mentioned earlier that you feel like you have a medical condition. Do you think other people understand that?
When I've spoken to people that I have not met a trans person before and had quite a negative view, they've actually come around and understood that, because they understand that it's not something I'm choosing. But I think a lot of people are offended by it being called a medical condition. I think it needs to be destigmatized, because there's nothing wrong with having a medical condition, but it does mean that it's something that needs to be addressed. And if you're claiming that you need a medical treatment, that's because you have a medical condition. Otherwise, it would just make it something I'm choosing.
Elliot, gender dysphoria is listed in the DSM, a guide to diagnose and treat mental disorders. How do you feel about classification?
I definitely agree with the reality of the fact being that it is a medical condition that you get diagnosed with, and the process of diagnosis is thorough, and I think that is definitely valid in terms of it being a medical condition. And I think also at the same time that there is this negative connotation that's associated with it being labelled as a medical condition, which needs to change. I am very comfortable acknowledging the fact that I have a medical condition. In fact, I probably have other medical conditions that have gone under the radar because of masking and because of needing to adapt to a society that doesn't like my honest expression. And I've needed to, as a survival mechanism, move past that. And this is a part of who I am, and that doesn't mean it's a bad thing. It just means that I'm something that is a little bit different, and that's okay.
Vanessa, is there a distinction between transgender as an identity and gender dysphoria, the medical condition?
Certainly, gender dysphoria is a condition in the DSM, and it's characterised by clinically significant distress around gender-related concepts. So that clinically significant distress is really important. Being transgender has not necessarily, you don't have to have gender dysphoria to be transgender. This is an innermost sense or feeling or a belief about yourself. And I think they're very different sort of concepts. The issue though for therapists is that we are told that we have to work with one particular model for people with gender dysphoria and transgender people, and that's particularly problematic. And that's using only that gender-affirming care model.
Olivia, is it possible to interrogate someone's gender dysphoria without undermining their identity?
Absolutely. Asking lots of questions about your physical health, your mental health, how you're getting along with folks in your family, social friends, academic ability, etc. So you're looking and making inquiries about all aspects of a person's well-being, but also what are things that are causing them distress. So you can most certainly make inquiries about whether or not clinical distress is present. And we don't just ask about clinical distress around gender, we ask about is it present in any area of life and take a thorough history, etc.
Some governments around the world are winding back medical care for transgender minors, leading to court battles and reviews.
In 2025, clinicians in Queensland and Northern Territory public hospitals were banned from prescribing puberty blockers and/or cross-sex hormones to children for gender dysphoria. The United Kingdom has also banned new prescriptions in both public and private clinics, while New Zealand has signalled its intention to impose a similar ban, pending a judicial review. Several European countries have also announced a more cautious approach to medical treatments. And in the United States, care is polarised, with bans in place in over half the country. Many of these jurisdictions cite the so-called Cass Review in their reasoning for a changed approach to gender-affirming treatment for minors. The Cass Review was commissioned by the UK's National Health Service following an exponential rise in children presenting at its public gender clinic. Its author, Hilary Cass, found no good evidence on the long-term outcomes of medical treatment and said results are exaggerated or misrepresented on all sides. The Cass Review is not endorsed by Australia's peak medical bodies, and the federal government has called for the development of new national guidelines for the treatment of trans people under 18.
Olivia, Australia has no national guidelines when it comes to medical treatment for transgender minors. How can you be so sure about your approach?
I don't know that I would use the words that I am so sure, but one thing I'm sure of is that if after, 15 years of seeing hundreds of young people, there was some enormous, hidden, terrible risk that we are all unaware of, we may have seen a glimmer of it. We may have seen, a patient lobby group with dozens or hundreds of people who've been to these clinics saying, I regret what happened, or I've had terrible side effects that I don't want. We may see some of the Royal Colleges of Physicians and GPs and psychiatrists saying, stop gender-affirming care. But actually it's the opposite. All of the major medical associations in Australia and in other countries are supportive of gender-affirming care. And in fact, in the UK, the Royal College of Paediatrics has criticised some of the government responses to the Cass Review and made statements to the effect that they believe that it is harming children, some of the actions that have followed as a consequence of the Cass Review.
What about you, Vanessa? Gender-affirming care is considered best practice in many parts of the world. How can you be sure of your approach?
Similarly, I think it's very hard to say, yes, I'm absolutely 100% sure. But again, we have to follow the evidence, and we have to follow the evidence base of these systematic reviews that have come to the same conclusions, that particularly the medicalised care of children and young people doesn't have a discernible benefit, not one that's reliable. And look, I am probably one of the very fewest psychologists in Australia who's had to defend my approach in court. And I've been questioned and cross-examined on the approach that I use. And in that instance, it was actually the preferred approach that was deemed to be the approach to be used by the court.
Sandy, the medical professionals don't agree. How do you know what to do?
You do what's best for your child. Cairo was going through some really hard times. I listened to Cairo and we really discussed what was going on in depth. We have a good relationship, so that really helped. So, at the end of the day, I think you just really got to be able to understand what they're going through.
Do you think other people recognise the challenges parents face in this space?
I don't think they do. In terms of the counselling, there was none for us as a parent. The only guidance I got was from Cairo, just explaining how they felt at the time. But no, I don't think there's enough education out there for parents that are going through it.
Michelle, you're the parent of a teenager who has mental health struggles. When you went looking for professional help, you say the focus moved towards gender affirmation and important mental health issues were overlooked. Your child is nearing 16. What are your concerns as they get older?
My concerns are that where we live, she can access the gender clinic from 16 without my consent, which is terrifying. And because my daughter does have such a complex mental health history of psychosis, dissociation, autism, anorexia. She may be assessed as competent to make her own medical decisions, and if she does medically transition, there's the possibility of infertility. And I think the biggest one for me is the unknown risks.
How has this experience impacted you and your family emotionally?
It's all-consuming, my husband and I. Every time my daughter comes up, it's like, oh, what's she wearing today? Is today the day that she's going to demand that she be put on cross-sex hormones? There is a level of grief associated with her not wanting to be seen as my daughter. Obviously, you don't know what your children are going to be like when they grow up, but our relationship is not at all what I thought it was going to be like. I was really not looking forward to her teenage years because I thought, oh my goodness, we're going to be like telling her, no, you can't wear that, put some clothes on, you know. Didn't imagine that I'd be going, please put on a skimpy dress. Put on some makeup.
Sandy, you didn't consent for your son Cairo to have hormone therapy before he turned 18. Was that the right decision?
I think so, but on listening to Grace's example, I think there's variables, you know, it's different for everybody. It just depends on that person.
Does your husband, Cairo's dad, feel the same way?
About
everything.
He's very old-fashioned, I must say that. He's struggled with it. We both have. We thought, well, no, what have we done wrong? Why is Cairo going through this sort of stuff? We doubted ourselves as a family. It was very hard. It still is. He has really struggled, and I guess it's made it harder for me to hold everybody together.
Elliot, your parents work for the Uniting Church. Were they supportive of your transition?
I'd say yes. There is a difference between reaction versus rejection, and I think it's very appropriate and expected for parents to react instead of reject. And there's a two-way street between you being the child that's come out as trans and the parent experiencing you coming out and or in some cases being let in and being told how you truly identify. And my parents were very open-minded, but there's only so much that you know until it's one of your own children. And I think that definitely hit it a little harder for them, being more on a personal level. My dad is more on the effeminate side in some cases and was bullied for it in some cases in school. And my mum has always been a very outspoken, assertive woman who some people would stereotype as a mannish woman. So when it came to raising me and it came to raising my siblings, we watched things like Star Trek, sci-fi TV shows that would openly engage in these kinds of conversations. So, you know, they loved me very much, and all they really cared about was that I was going to be healthy and that I was going to be happy and that I was going to be supported and educated throughout the whole process, and the same for them.
Grace, you're 25. How's the future looking for you?
I think the future's looking pretty bright, and I think that transitioning, it's not a cure-all. You know, we all have things, no matter who we are, that trouble us. And life is hard sometimes for all of us, and it can be really difficult. But I think that when we all just come together and we all just are there for each other, that is when we really can connect and really support each other and just uplift one another to a point where we can look positively to the future and also try and discern what are some things that can be changed in order to make ourselves happier.
Kev, you've been living as a trans man for most of your adult life. If you had your time again, would you still transition?
I struggle with that one. It's worked for me. I've enjoyed it. I think, though, like how it is being viewed by younger generations, like I kind of wonder if we've opened a Pandora's box that's going to be very difficult to close or to deal with it all. Like, it's creating some serious problems.
Cairo, you've been on testosterone for about a year. What's life like for you now?
I feel so much more comfortable just existing. I'm more comfortable to talk now. I didn't want to talk before. I can go into the bathroom without being looked at weirdly, like, why is this little girl in here? Like, what is going on? I just feel so much more confident and comfortable, and I like my body more. It's way more masculine. It's just, I feel like 10 times better. So, yeah.
What are your plans for the future?
I have my top surgery consult in November, so I should be getting top surgery either end of this year or the start of next year, so it's very exciting.
Yeah, you feel good about that?
Yes.
Thank you so much, and thank you to you all for being here. I'll see you next time.